Welcome to the first installment of our weekly pharmacology series. As future healthcare professionals, understanding how drugs work is essential for providing safe and effective patient care. In this video, we'll delve into the fundamental principles, exploring general pharmacology and pharmacokinetics. General pharmacology. Pharmacology is the science that studies the biochemical and physiological aspects of drug action, including drug absorption, distribution, metabolism, excretion, toxic doses, and specific mechanisms of action of drugs. It can also be defined as a combination of different sciences like plant therapy, poisoning, vitaminology, endocrine and chemotherapy. In pharmacology, we study the mechanism of action of drugs based on the findings of physics, chemistry, biology, biochemistry, and physiology. It has three main sections: theoretical or general, experimental, and clinical. Theoretical pharmacology is interested in the normal regularities of interactions between drugs and the body. Experimental pharmacology studies the effects of drugs on the animal organism. Clinical pharmacology examines the effects of drugs on the patient's body. Pharmacological effect, a change in metabolism and cell function. Pharmacotherapy is studying the use of drugs to treat concrete disease. The mechanism of action is how the initial reaction takes place. The initial pharmacological reaction is characterized by biochemical, physiological, physical and chemical changes in the metabolism and functioning of systems and organs. The two main areas of pharmacology are pharmacokinetics and pharmacodynamics. Pharmacokinetics refers to how the body controls the absorption, distribution, biotransformation, and excretion of a drug, while pharmacodynamics is the study of the biochemical and physiological effects of a drug and its mechanism of action. Pharmacokinetics. Drug transport. The movement of drug molecules in the body depends on their absorption, distribution and excretion. Drugs can cross cell membranes by various mechanisms. Absorption mechanisms are like those of membrane transport, passive diffusion, diffusion with the participation of carriers, filtration, active transport or pinocytosis. The cell membrane, as a lipid bilayer, also acts as a barrier to certain drugs. Passive diffusion. Most compounds enter cells by diffusing across lipid membranes as non-ionized moieties. Factors that influence a molecule's passage through a membrane are the size and charge of the molecule, the lipid-water partition coefficient, and the concentration gradient. The two types of passive drug transport are simple diffusion and filtration. Simple diffusion. It is characteristic of organic acids and alkaline. The greater the concentration gradient, the greater the rate of absorption. The greater the absorption surface area, the greater the flux of drug. Diffusion constant is directly proportional to temperature and inversely proportional to the size of the molecule. The higher the lipid-water partition coefficient, the greater the drug flux. At rest, diffusion causes molecules to pass through lipid membranes in an uncharged state. The pH of the environment affects drug absorption and excretion by passive diffusion. Acetylsalicylic acid and other weak acids are better absorbed in the stomach due to the acidic environment. Alkaline drugs are better absorbed in the small intestine due to the high pH. Filtration. It is a property of pure urea, water, ions, and some polar and non-polar low molecular weight molecules can diffuse across the membrane, suggesting that pores or channels may be present. Capillaries in some vascular beds, example the kidney, have large pores that allow the passage of protein-sized molecules. Transporter-facilitated diffusion. It is characteristic of amino acids, vitamins, and other drugs. In this type of transport, movement across the membrane is facilitated by macromolecules. This is a saturable process that is an external concentration can be obtained. An external internal concentration gradient does not increase the influx rate. It is selective for the chemical structure of the drug, that is, the transport mechanism only transports drugs with a particular molecular structure. no energy is required. Since it cannot move against a concentration gradient, it continues to diffuse. Active transport. It is characteristic of cardiac glycosides, etc. Active transport is in many ways similar to carrier-mediated diffusion, in which movement across the membrane is mediated by macromolecules. It is a chemical structure selective, saturable process. Several important features distinguish active transport from diffusion processes. Active transport requires metabolic energy, which is often produced by an enzyme known as sodium-potassium ATPase, which transports molecules up their concentration gradient. Pinocytosis. It is a characteristic feature of fat-soluble vitamin preparations. The vacuolar apparatus of certain cells is responsible for this process. There exists both fluid phase pinocytosis for substances such as sucrose and adsorptive phase pinocytosis for substances such as insulin. Bioavailability. It is the relative rate and extent to which a drug penetrates. Affects general blood circulation. This is especially important when taking medication oral intake. Factors that affect bioavailability: drug solubility, stomach contents, meal contents, tablet size, quality control during manufacturing and formulation. Absorption. It is the rate at which a drug leaves the site of administration and the extent to which this occurs. Absorption of a drug through the mucous membrane or capillary walls of the gastrointestinal tract depends on the physical and chemical properties of the drug. Route of administration. It is an important factor that determines the speed and efficiency of absorption. The enteral route. It is the most common route of administration. Examples of enteral routes are oral, rectal, sublingual, buccal and duodenal. Advantage oral management. Food routes are, in principle, physiological. The safest path of management. After oral administration, the release of the drug into the bloodstream occurs slowly, avoiding high and sudden blood levels and reducing the risk of side effects. The dosage forms available for nutritional management are convenient and do not require sterile equipment. Disadvantages of alimentary administration. It is not convenient for first aid. The main drawback is that the absorption rate is different. That is a problem when the blood concentration is separated from the desired therapeutic effect and toxic effects. Irritation of the mucous membranes may occur. Patient compliance with treatment is not guaranteed. When some medications are taken orally, significant hepatic metabolism may occur before the drug reaches its site of action. This is called the first-pass effect. Passage through the liver and subsequent early hepatic metabolism is avoided by taking the drug sublingually, but only some drugs can penetrate mucosal surfaces. Parenteral routes. The main advantage is that the drug bypasses the digestive tract. Examples of parenteral routes: intravenous, intramuscular, subcutaneous, intraperitoneal, intraarterial, intrathecal, transdermal, intranasal, and inhalational, etc. Advantages of parenteral administration. The drug reaches the site of action faster, providing the rapid response needed in emergency situations. Dose: in many cases it can be delivered more accurately. Parenteral administration can be used when other routes are not possible, for example, if the patient is unconscious. Disadvantages of parenteral administration. As absorption increases, side effects may increase. Sterile formulation and aseptic technique are required. Local irritation may occur at the injection site. Parenteral administration is not suitable for insoluble substances. Parenteral administration may result in HIV infection and phlebitis. That's a wrap for today's deep dive into the world of pharmacology. We've covered the basics of pharmacology and studied the topic of general pharmacology and pharmacokinetics till the parenteral route of administration. We will complete the topic of pharmacokinetics in the next part. Remember, understanding these concepts is crucial for any healthcare professional. If you have any questions or want to delve deeper into a specific topic, feel free to leave a comment below. Don't forget to subscribe to PharmaWire for weekly updates on new videos. Thanks for watching. Good luck. Keep learning and keep growing.